Hi, Maggie. So Maggie here is my colleague at Auckland Shoulder Clinic, and I think it is perhaps the right time to ask you this question since we've been doing telehealth through this lockdown. So Maggie, tell me, how did you have to, or did you have to adapt while delivering telehealth physio in terms of your approach to assessment and treatment?
It's been such an interesting experience, hasn't it, Pradnya? You know, I think if somebody had said to me at the beginning of last year, all my physio would have to be online, I would have been, what are you talking about? I can't do that. And really, I can. And I've been, I don't want to use the word astonished, but I have been surprised how effective we are this way. I mean, we see quite complicated shoulder patients, don't we? And I think I can still see their muscle patternings. I still get I think for me, getting the history and the story, I do that exactly the same. I was really worried, and I remember talking to you about this. Oh, what if I'm not going to get to know my patient, you know, they are online and I'm going to be distanced from them. And my impression has been I get to know them much better than when I'm in the clinic, because I'm in their bedrooms, I'm talking to their partner, their kids are holding the camera, you know, like it's much, I felt probably better connected to my patients in this format than what I do feel in our formal clinic environment. You know, I found that to be a difference. I think the difference has to be in the objective assessment. So everything I can easily talk to my patients and I find it easier to relate to them, but there are some things that I am a bit disadvantaged because I can't put my hands on them. And so we just have had to be creative, haven't we? There's always, I think, on the whole, we've found a way around that. It probably has involved us moving our patients in different positions and getting them to move their shoulder and hold on to their shoulder or do things. They are probably more engaged in their assessment than what they were previously. But it's been challenging, but we are just as able to deliver effective healthcare this way as face-to-face. I've been very surprised. So
that's really great to hear, Maggie, because I couldn't agree with you more. And my experience has been similar. A question I would like to ask you is, now that we obviously have been 8 weeks and we don't know how long has it been, why do you think, or is there a barrier with people or from physiotherapists in engaging telehealth?
So I think the perception of what we do is one of our biggest barriers. I think lots of people, I know my family think that I massage people. They think that's what I do for a job. And it's just so enlightening. Is what I really do is diagnose and treat people with complicated shoulder problems who otherwise aren't addressed. Very rarely now, as a specialist physio, do I even put my hands on somebody. I come from a biomechanics exercise background, so that's definitely been an easy shift for me. And same for you, you know, in terms of what you can deliver online. I think especially for shoulder rehab, so much of it is about your shoulder blade positioning and the position of your shoulder in its socket that we can change really effectively with exercises. And what we can't change, where we might have mobilized you, we can just adapt by stretching. So you know, like it's been a really interesting experience, you know, but I think the perception is that's what we do. And once patients get into our clinic, they can see that that's not what they do, and they see themselves getting better, so they buy into it. But the barrier still sits there for the general public, I think.
That's a really good point, Maggie. And it's great to have that little chat with you and just sort of to know that our experiences have been kind of similar. And I hope if other physios understand that and, you know, change their perceptions about telehealth, perhaps more patients would get on board, because we really don't know how long we will continue in this. And maybe this could be a new way of delivering physiotherapy. Do you think that could
But
be?
I actually said what I've seen over this lockdown, and for me, but also for the rest of the team, is engagement from across New Zealand, because they know that they can access me then online when they wouldn't be able to. And I know the same for you guys, from Coromandel into the Waikato up into Northland. It's really easy for people to then access expert level physiotherapy, and we can deliver results. So I don't see that changing. I think it if anything, it spreads our reach so we can help more people.
Thanks, Maggie. Nice to chat with you.
Nice to chat with you.
See ya.
See ya.